Hi, everyone, and welcome to the Dallas Plastic Surgery Podcast. I'm Dr. Ricardo Meade, and I'm joined by two super fun young moms who have very generously decided to share their experience. We're going to talk about Mommy Makeovers. That's the concept. Believe it or not, a lot of patients don't know what it means. Some of them come in asking, what is it? Why would you get it? And you guys have a real life experience of that whole journey. So many of us, I know what it is, but I don't know like how nervous you are. What is it that you're afraid of? And then now you guys are both Emily and well, you each will introduce yourselves, but each one of you had it and remember those fears. And then now you're on the other side of all of it. Mm-hmm. And I don't know how clothing fits. How do you still do the front tuck? I don't know. You guys know so much about this stuff that the surgeons actually never hear about. And believe it or not, patients love knowing about that. And I don't know what to tell them. So I think a podcast like this would be super helpful for the interested young mom. So maybe each one of you introduce yourselves, your fun selves.
Yeah, I'm Emily. Teighlor and I are sister-in-laws and kind of went through this journey together. I guess I'll just kind of talk about why I kind of opted how I ended up here. And then you can kind of talk about yours because it's interlinked. But I had two little babies and 2 C-sections, and it left my body ravaged.
You already had the scar.
Yes, already had the scar. And then as all C-section or most C-section moms would know, it leaves you with just this kind of what we call the water blob. And even when you've lost the baby weight and you're working out, there's this extra skin and just kind of fat that kind of accumulates and it makes you look larger. You're not able to wear what you want. So I think Teighlor and I were in this place of, working out, eating really clean, and still not seeing the results that we wanted in our clothing and in swimsuits and things. So we just kind of, I think, have always talked about wanting to do a tummy tuck, Mommy Makeover, and I started researching and doing consultations and ultimately decided that was the only way I was going to get that result.
What about you, Tyler? How did kind of pregnancy and, how did that change your body? Because not everybody has that, what do you call it, water blob? Not everybody has the exact same thing. I'm sure plenty will hear this and be like, I know exactly what she's talking about. Mm-hmm. What did you notice that, as such a young age, you guys are noticing these things. Some women have their babies older and it's even harder to recover from that. So,
so the water blob, it was like, the only way I know how to describe it is like a flotation device, really. Like, I feel like if I was drowning, it would float me.
It would save you?
Yeah.
Such a good thing. So now you're in danger from drowning.
And like, as far as like you mentioned earlier, doing the tuck, there's nothing to tuck. So there is no, it's all like
out there.
Yeah. You see straight down. Mm-hmm. So, but I had the same thing. So already had the scar, 2 babies, 2 C-sections. And as I lost weight, it just felt like the water blob would continue to be the same. Like it wasn't shrinking. So the rest of my body's shrinking. That area is not. And it's just one of those things like you knew it was never going to be the same.
It's interesting. I almost feel like that little area, it's almost like you guys are genetically made for that to be there so that it can stretch to have a baby.
Yeah.
You know what I mean? It's like having a uterus. You're made for that to be able to hold a child. And that little roll, I see it in the patient, no matter how lean they get.
Yeah.
That it is like a little blob of tissue that it ain't going away.
Yeah. It's like a little protected.
Well, and I know that your mom, she also had a C-section and is thin and still always struggled with it. And so I think that Teighlor had that kind of input from her mom saying, hey, all these years later, even though I've, maintained slim weight, et cetera, it hasn't gone away. And I think just kind of realizing that we're still young and we have like the ability to reverse that even in our 20s and, young 30s.
We don't have to hate our bodies for our whole lives.
Right. And don't wait until you're, okay. So here's another big one that comes up often. That moms will tell me, but I'm a young mom. It sounds like y'all have like cousins now that very similar ages.
Right.
And that's so cool. Like how much fun, imagine the decades of fun those guys have ahead of that's so much fun. And y'all are also both so much fun. And so what about the mom that says, but I want to be alive for this. What if I die in the surgery or something? Are those fears or what are the fears? I know some of the patients come to me with that and I have to kind of talk them off the edge. And I'm like, guys, we do this, 4 days a week. It's not that risky, provided you go to a properly qualified surgeon, anesthesiologist. And I know my anesthesiologist, he's a friend of mine.
Mm-hmm.
Now, when you go, we were talking earlier about international travel. What if I go to Miami? What if I go to Turkey? What if I go to, I don't know where? It's a lot cheaper, but then there's all those risks. So that doesn't make sense. So in good hands, the surgeries are extremely safe.
Mm-hmm.
But what are the fears that you had if you take yourself back to the pre-op days, like when you're considering doing it?
We were definitely both. That was a conversation that we had with each other, because I think the mentality is, okay, this is a purely elective cosmetic surgery. Right. So, although it is a very safe surgery, the risk is non-zero, right? And so I think, we took it really seriously. And the way that Teighlor and I kind of tackled it is I went to, my general prac and got my blood work and checkup. And then we were really serious about our diets and anti-inflammatory.
Leading up to it.
Yeah. So we were eating really, really clean, anti-inflammatory. We were trying to take natural supplements and work out and just be as strong and healthy as possible going into it. Yeah. But I definitely think that when you have that kind of, even as, not necessarily medically like scared or like paranoid people, I think you definitely think, well, there's some risk here. And I am a mom of young children. Is this, like foolish, I guess.
I think you also felt that you just did feel that you trusted me.
Yes,
just as your surgeon, you knew that I was taking care of all of the angles, all the possible surprises.
Right.
And I think you felt comfortable with it.
No, for sure.
But that's really funny.
And she would say that. But also, I know that even the staff at the surgery center, so the anesthesiologist that we had was fantastic.
That's a great one. What was it like? So now you've decided to do it. What was the process like? On the day of surgery.
The only reason, to be honest, my mom always had like dreams of plastic surgery. So it wasn't like a taboo topic. But I never really saw myself getting there or being able to do it. Like it just felt too big, like it was like
that's interesting.
Something that was a goal, but never really going to happen. So when Emily jumped on, like she was like, oh, I'm doing it. Like I'm going to consultations and stuff. And then I started being like, well, is it really that out of reach?
Right.
Like if you're doing it this easy, maybe this is actually an option for me too.
Well, that's a great point. I think that's how this all started.
Yeah.
Like the first plastic surgeries.
Yes.
It took that personality that's just the trailblazer.
I'm going to do it.
She's just going to do it.
And then I couldn't be.
And then someone sees it.
Exactly.
Well,
I couldn't be like, she's going to be in a
she got away with it.
Yes.
It looks great.
And then I'm going to be sitting next to her like in Vegas.
With your water blob.
With a water blob? I could not let this happen.
Excellent.
So I was like, there's no choice. We have to do it together.
Yeah. Right. I think that there's a misconception. I think the price obviously is kind of not super transparent a lot of the times. And so it's kind of this ambiguous and scary between the price and the recovery. I think that people think that the barrier to entry is a lot higher than it actually is.
Yeah.
That's a good point. Okay. Day of surgery. You're checking in. It's Dallas Day Surgery Center. And do you take yourself back to that day? What was that like? Most of the patients that when I talk to them, they're super nervous. Sometimes we'll have them take a little something the night before so they get some sleep. Sometimes we'll have them, as soon as they get there, we'll give them a little something, especially if they're very, very anxious. Because sometimes you have to sign paperwork and stuff. You can't be under medication. But what was y'all's experience like?
We had talked about we knew that was the experience of a lot of women because there's a lot of like online communities and forums where you can go and read about other women's experiences. So we were both aware that sometimes people needed like anxiety medication or, whatever before. I don't think either of us had that experience, though I feel like I went in pretty clear-headed. Of course, there's a little bit of the jitters just because it's not an everyday experience, for the patient. But I remember going in and the anesthesiologist came in pretty early on and he was very warm, very engaging. And I think it just kind of disarmed my anxieties. And I just remember being in the waiting room with my husband and kind of having conversations with the staff there. And I think I was pretty clear-headed. I wasn't too anxious about it.
Well, you guys are great. Like everybody at your like office is just so, your bedside manner is unmatched. And so everybody makes you feel so comfortable and so relaxed. Like it doesn't feel, you would think that being in a gown and that, having to like bear it all to people you don't know would be like, way more nerve wracking than it actually was. You guys just make it feel like it's so normal and natural. And
well, I think it helps that
yes,
at Dallas State Surgery Center, that's all they do.
All day, right.
You're going to be one of like, I don't know.
So many naked bodies that you see.
Day.
Right.
And they truly are just trying to make you feel comfortable because, and there's no judgment. There's no, I have patients that they look great. They just want to look better.
Right.
I have patients that, you're talking about the water blob or whatever that you're trying to fix. Some patients have tummy tucks. They really, you see them and you might be like, well, she doesn't need a tummy tuck. But then you do it, and then afterwards you're like, wow, that
it made a huge difference.
And our nurses, our staff, they're just used to it.
Yeah.
Because you'd just be surprised at the ripple effect of what we've been talking about. Those girls, their friends did it, and so they want it.
Right.
And now you see on, celebrities getting all this plastic surgery done, and they're beautiful. They don't need anything, but they do look a little better after. So you're like, gosh, what did they do? And so there's just no judgment, I feel, from those nurses. And that's why there truly is no judgment. So you just feel comforted by them.
Yeah.
In fact, most of them either have had it or want it.
Right.
It's just a matter of time, because they're
and you would think, surgery center that it was like cold and sterile, but that wasn't the experience. It was very warm and engaging. So I think that disarms a lot of the anxieties. You're in an, kind of intimate space with the person you bring, and the staff is.
Do y'all remember walking to the OR? That you have to walk yourself?
Yes.
Yeah. A lot of patients point that out to you. You don't remember that?
I don't know. I blacked out.
Yeah. So they lay your gown.
Yeah.
Yes, I do actually. Now that, I do remember that.
And that's it. I usually tell the patients, all right, give them a kiss. Or whoever is there with them.
Yeah.
And it just feels right to give a kiss. Or
right.
It's not like a departure thing. It's just, see
right.
Yeah.
And then you walk yourself to the OR in the gown. Then you walk into the OR, if you remember, but the windows are floor to ceiling.
Yep.
So you kind of see North Park Mall. And we're up on the top floor.
And there's music playing.
Usually we ask the patients what kind of music kind of comforts them, like while they're asleep. I like all kinds of music. So whatever they say. And then the anesthesiologist, Dr. Herbert, he does most of the surgeries, not all of them. He is a savant about music. And he'll bore you to sleep about the band and when they started.
Yeah.
And so he probably talked.
He was so sweet. Yeah, he was really,
him.
really great.
Yeah, he was great.
He even called beforehand and,
nice.
Made sure, he'll ask if you have any questions, any anxieties. And, that was a day or two before surgery. And so you have a lot of opportunities to kind of build rapport with the staff, which I really do think makes a difference walking into the day of surgery.
And it was impressive because whenever I laid down on the table, they give you the medication. He will literally tell you how it's traveling through your body as it's happening. And so you can feel it happening as it's happening. And he's like, okay, now it'll cross over into your brain. You can feel it. So that honestly made me feel a lot better. Like he really knows what he's talking about. He's, dead on.
It instills a ton of confidence.
Yeah.
Right.
Yeah. So you really feel like everyone around you knows what they're doing and talking about. But the day of surgery, I didn't really feel nervous. I was just like ready to see on the other side because, now looking back on it, it is instant gratification after you're finished. Like the first time you see yourself,
When was that? When is the first time?
Night, I think.
That night?
Mm-hmm.
Did y'all spend the night in our hotel or no? Okay. So we have a facility that I think it would be interesting to talk to another patient who did that because I find the facility to be great because the spouse or the significant other, whoever hangs out with you, stays in a bed next to you, but they don't have to do anything. They rest that first night. And that first night is the hardest night, I think. You would test that? Okay. So first night's typically the hardest in that, you don't know when to take your pain meds. You're not really eating that much. There might be some nausea from anesthesia. Maybe the IV is still, it's just a little, it's the ickiest of all the nights. And then day 2 is much easier. So we like absorbing that rather than telling your husband, hey, I think my rib hurts. Is that normal? And your husband's like, I don't know, he's like a finance guy or a real estate guy. Well, he's not going to be able to, your only option is call the on-call pager or go to the ER. Those are terrible options. So staying overnight, often patients, they just really like the comfort of doing that. But having gone home, which a lot of the patients go home as well, I think would be a really good, conversation to have. What is that like? Was there ever a part where you were like, gosh, this is tough, the first night? Or is it just the actual, there's pain. I know there's going to be pain. I'm taking my meds. I'm staying on them and I'm putting food. Allison, our nurse, tells me often that the patients, they'll take the pain meds and there's nothing in their stomach. So then they get nausea. You just have to kind of be on top of all of that stuff. So prior to surgery, y'all had your conversation with Allison about what to do. Did you feel pretty informed? Did you have to Google things? What was that? What was your preoperative preparation like for the post-op?
I did have pain the first day, and I called Allie.
Yeah, you called the nurse.
Yes.
What did she say?
She was just pretty much like split. I think we ended up like splitting an additional pain pill in half.
Right.
So I got another half, and then like to kind of catch up and get ahead of it, and then that next dose I just took a half.
Right.
So that was kind of how. But after that, I had
That was easy.
It was comfortable. Yeah.
You know, I prescribe really, really low doses for all patients. Some of the patients, they're 85 pounds and others are, they're 240. And we kind of have somewhat, I need to keep everybody protected so that I can do the next 1,000 patients and there's never an overdose.
Right.
So my doses are always really low. So we leave ourselves that margin to do a little bit more for anybody that's calling.
Well, I will say our body types are very different.
How you
medication on her, like the amount that you guys gave her took over her whole everything. Like she didn't need anything additional. If anything, she might even need it a little less.
Yeah, I think we ended up cutting some of the doses for me. So it is interesting how it can kind of affect, but it's nice because you guys are so accessible that you're able to say, this is what I'm feeling, this is what I'm experiencing, and it's able to be adapted to your needs. And as long as you're communicative, it really isn't too intimidating.
No.
We definitely aim to be highly accessible. A lot of the patients have my direct cell, which they typically don't use it because people don't want to bother me. But either through Instagram, they'll direct message. They can call the on-call pager. Often they're communicating directly either with Allison or with just the staff. Usually we try and square things away so that by the time the evening comes, you're kind of tucked away. Did you get a good night's sleep that first night? Or is that a night where don't expect to rest?
I don't remember having any problems with sleep.
You didn't sleep.
Oh yeah, that's right. I was hyped up because of the anesthesia and pain meds. That's right. I was hyper.
And I was like, you need to rest. Like your body is
forgot about that.
She's like, I can't. And I'm like, you need to relax.
Yeah, that's right. So I guess like we could go back up a little and like answer a little bit about like the prep, like the prep that you asked. So I think that we both did quite a bit of prep beforehand. So we both bought like electric recliners so that we would be able to.
That's a must.
It's a must.
Situation for me was like
how many days did you use it? Because I hear patients
2 weeks.
After about
2 weeks
at least.
I hear at about 5 to 7 days they start complaining of back pain.
Oh, interesting.
Because they're sleeping in the recliner. Were y'all sleeping?
Yes. Yeah.
Well, mine like laid back. And I could like stretch it to fit whatever was comfortable. And
Same with mine.
Which I moved to my bed sooner than I wanted to because my husband was like, I miss you. And he kept trying to crawl into the recliner with me. And so I was like, I want to just move to the bed.
They don't fit.
Yes. So I moved to the bed like quicker than I would have, but it was still fine. And I think it was like at the 11-day, 2-week mark.
And then in bed, did you put pillows under your legs to stay flex or no, you went flat at about 11 days?
I have an adjustable bed, so I kept mine adjusted.
I would say I went fairly flat.
Really? That's early. Okay.
Yeah. But I was back at work on day 11.
Just for the listeners, in general, we tell people to wait a couple of weeks. If you have the ability to do it and there's no resistance, that's fine. There usually is resistance because I'm pulling things pretty snug.
I was significantly more hunched over than you were, though.
But there was tightness there.
Yeah.
It wasn't just like, but that's what I mean when I did it a little bit earlier than I would have liked. But I could still do it.
Okay.
And I was still managing. Honestly, though, my flank situation, I couldn't lay side to side or anything like that. And that's how I love to
were changed radically, though. That's worth it.
Yes.
Oh, my gosh.
Oh, yes. But the pain that I was having that night came from that area, not this, not the chest. It was that back flank area. So I don't know just my body type or whatever, but the lipo seemed to do more like pain than anything else.
Those are the two things that hurt. It's either the lipo or the tummy tuck. The breast implants hurt as well, but when I'm doing all of them,
you can't even feel.
Yeah, the breast implants were
nothing.
an afterthought.
And they were so healed so quickly compared to what it seemed like. Mm-hmm.
Which I think is one of the motivations for doing all of these together. Some patients are like, well, let's split them up. Nobody really wants multiple operations.
No.
Everybody wants to just get it done and just let me just heal. Another benefit of the Mommy Makeover of combining these procedures is the discomfort.
Mm-hmm.
It's like if you have a toothache and you stub your toe and you have an ingrown toenail or something, and just one of those is going to be, that's the one. When you stub your toe, you just forget the other two. And I think this is a lot like that because patients.
I'm just so glad that I did it all at once.
Yeah.
I had 1 second where I almost didn't do the breasts.
Right. That's the most common, like, should I not?
I almost skipped it. And my husband actually, not that he is that way at all, but he was just like,
I remember that.
If you're going to look at yourself afterwards, and I think that you'll regret it, I think you should reconsider. So
you would have regretted it.
Oh man, when I see my before pictures, if I wouldn't have got it done, I would have scheduled that day. There's no doubt in my head. I had to have the breast done.
But that being said, I do think that the breasts were a non-issue as far as recovery went. I think that, I was the opposite. Your lipo bothered you the most. Mine didn't bother me at all. It was just that muscle repair, tummy tuck. That's where the majority of my pain came from, and the majority of her pain came from lipo. Okay. So it was interesting.
So how did you decide? We've already talked a little bit about the water, but how did you decide what procedure you wanted for your Mommy Makeover? Because if you think about the moms that are listening, they're thinking, well, yeah, but I didn't have that. Maybe I don't have the blob. My tummy's actually pretty good. It's just the breasts. I just need the breasts reshaped or bigger or lifted. Or how did you decide, okay, these are the things that I want? Because obviously when you do stuff, there's always more. There's always gonna be something else. I wish I could have. How did you narrow it down to, okay, this is what we're doing? Because you already said your husband helped you decide, just do it. But I'm trying to define the it. How does a young mom decide, okay, this is what I need done. Otherwise, I'm going to wake up and just be focusing on that.
I think for me, I approached it from, I knew that the tummy tuck was a non-negotiable. I knew that was really the driver behind the entire surgery.
That drives most of them.
Yeah. And so from there, it became, do I really want to worry about another surgery, kind of be dissatisfied if I'm going to go through the effort of recovery, taking off work, going under anesthesia? Should I not just do what I want? And that really was kind of where I decided, just purely for logistics, I'm going to just do it all in one fell swoop. Then I won't wake up with regret. Then I won't have to go through the process of, kind of doing this again, because I think that my boobs, post baby, they're just, mom boobs. And I just knew that eventually that would be something that I would want to do as well. And I thought I wanted to get it done in one fell swoop. So I didn't wake up thinking, wow, I got this, flat stomach that I wanted, and my boobs are still, droopy. So that was kind of really the decider for me, was let's just do it all.
My boobs were small. And I breastfed 2 kids, but they were small. So in my head, I was making sense of it like, yeah, but they're small. So what does it matter? Like, they don't look droopy because they're already small. So I kept trying to justify it that way, as far as like, do I really need this? I don't really know if I need this. But looking back at it now, they were like deflated. So they were small, but they were just like empty.
And not even realizing it at the time necessarily.
At the time, not realizing it. But looking back on my before pictures, it was very clearly, and I don't even know how, looking back on it now, because when I would look at myself in the mirror, I didn't look at myself and be like, wow, one of my boobs is like
lopsided.
Like it's a little bit lopsided. But then when I see my before pictures, I'm like, how did I never notice that before? So I'm just so glad that I ended up doing it all at once, because otherwise I would have been like, everything is perfect.
And I think you kind of followed suit with, let's just do it all at once. Like that was kind of the logic that you had as well, which is why stop short when when eventually that's something that we would want anyway.
For sure.
It's interesting to hear from my patients post-op. They see that before photo that you're talking about. And I can almost see in them like, oh, gosh.
Oh, it's shocking.
You really have no idea.
Shocking.
Isn't it wild, though?
Yes.
I just find it so fascinating that was you, though, I mean, for years and years and years and years.
I know.
You have the Mommy Makeover. There's something to this. The brain will amputate that memory.
Mm-hmm.
It just doesn't want to remember that.
No, it happens.
And I had that conversation with a patient yesterday, and she was like, "Hey, can I just see my befores? I'm just not sure if I notice a difference." And I'm like, "Really?" I was like, "Oh yeah, let's take a look at them." And she saw, and you can just see, I mean, their face drops like, "Oh my gosh, that's true." I think the brain just accepts and loves the new self in such a way that you're so built up with confidence now. You just love that. And maybe sometimes in yesterday's patient, there were still things that she wanted because she didn't do all the things. This patient did tummy and breast lift, but not breast implant. So now we're moving forward to breast implant. And that's okay. She's an older woman. That's fine. She just took it in stabs, different. But look at us. We're having that conversation and talking about surgery. She's probably about a year out, maybe less. But we're now talking about, another surgery, which she did. She paid less. She recovered less, all the things. And now saw all of the great benefits, loves it, is filled with confidence. And so it was so good, she wants a little more. So now we're going to another procedure. You omitted that step by blazing that trail, which I think is just interesting.
Yeah, it was definitely something I considered, was just the lift with no implant. And ultimately, I just decided through trying on, in the consultation, different like sizers and just different implants. And I think that helped me also kind of see it that, I can still do this, like looking naturally. It doesn't have to look, necessarily like
fake or anything like that. You can have a natural look without.
Right.
Yeah. And, to the point of, not really remembering your before pictures. This was kind of a running joke with you because she will show her before and after pictures to anyone who will see them. And she says that it's because she doesn't relate to the body.
Yeah. Well, I went through a phase. Okay. I hadn't worn a 2-piece swimsuit in 6 years or more since before I had my daughter. I went from January, I'll never wear a swimsuit again, to by the time May rolled around, I'm walking around in a 2-piece swimsuit like I own.
Like Sports Illustrated.
Go into. Yes. And so I had like these few months where I was no longer this old self, right? I could not associate with that body anymore. But this new body, I was also like, who is this? Because I don't know who this is. So I went through like a little phase where I was like, I'm just a floating head. I don't have a body.
Oh my gosh. The psychology of Mommy
making the switch. But it was amazing, honestly, because I never thought I'd wear a swimsuit. And now I'm walking around and I'm telling my husband, take pictures of me.
So powerful.
And then I'm sending them to, like, Emily, look at me in my 2-piece. It was insane. But I did have a moment where I was like, who am I?
Interesting.
Yeah.
I want to talk a little bit about the trailblazer patient, because so many of us can comfortably stand behind you guys. Oh, wow, he or she did this thing. I can do it too. But that person has to do it. So who did you talk to? Who did you rely on? What is it that, I don't know if you can rewind all the way back there to the decision making of, I think I'm just going to do this. Did you talk to other patients maybe? Did you just say, I think we're going for this. I want this. Or how do you reach that point?
Yeah. So for me personally, I didn't really know anyone who had done it before. So I didn't have anyone I personally knew who had gone through that experience. For me, it really was, I had been really diligent about eating well, and I had lost a lot of weight, all of the baby weight, and we were working out every day and really making incredible strides with just our health and taking care of ourselves. I mean, in that postpartum phase, it's just a haze. When you have 2 young babies, I had 2 boys 2 years apart, and just you are kind of just all about child rearing and that. And we finally got to the point where we're able to focus on ourselves, focus on our health, look how, we want to look. And I was just falling short because despite, eating very clean, despite being really diligent with working out, my body was just not even close to what it was before kids. Even though I was being stricter and more active and healthier than before kids. And so for me, I think it really was just this internal decision that at one point I just was like, what is the point of being this strict and like this disciplined if I cannot wear that dress because my body is making me look larger than I necessarily am? Or, what is the point of being this disciplined if I still feel like this weight is, hanging over me or following me around? So I think, I started I'm just going to book a consultation and we'll see. And I went to one or two consultations before I came into your office. And I think each consultation, it made it seem more real. And at that point, by the time I made it to your office, it was you guys connected it in a way that the others hadn't. So in my prior consultations, I would say, okay, I don't like this, C-section remnants. I'm not sure about my boobs. I don't love them. And it'd kind of be like, okay, well, you can do these implants and like, yeah, we can do that. You want to book surgery. And there wasn't necessarily this like engagement or kind of real like listening to, my concerns or my dissatisfactions. And so I still was kind of undecided and shopping around. And then when I had my consultation at your office, I feel like it was a very long consultation where I was able to look at different breast implant sizes and talk about options and figure out like what a personalized approach would be rather than necessarily kind of this dismissive, like, yeah, you can get boobs and a tummy tuck and move on. And so when I was able to really kind of logically talk through it with you and Allison, that's when it really kind of, I'm going to do it. Yeah, because it became even more concrete at that point.
And what percent of your decision was, well, Em did it, I think I'm going to do it? Or was some of this, you actually independently were pretty close, you just needed that one? How important is it for a friend to have it? Because in your experience, she did not have a friend and you did have a friend.
Right.
So.
For me, it was like majority hanging on him for sure. When I got into your office, I was dead set. It was going to happen at that point. Especially, one thing I loved about you is that you didn't put any ideas out there, right? It was all my idea. And it was all things that I want. If anything, you were like, you don't need that. You don't really need that. But I was like, no, this is what I want. Fine. Okay, we'll do it just because you want it type of thing. But for me,
it wasn't that pressure.
No, there was zero pressure. If anything, you were like, if you don't absolutely want to do the breasts, and I just want it, because if you're not in love with it, then what's the point of it, right, type of thing. So I loved that. And then I was like, yeah, you're right. And then after talking about it some more, I just went with it. Glad I did. But I would say majority of it hung on Emily for sure. When she just kind of went for it, and then I realized that it wasn't like that out of reach. And I was like, she's right. We're both still young. We still have so much we want to do. So many vacations we want to take together, things like that. It was
pictures with kids. I think that it was a big part of
the cute outfits, because we would shop together and we both have the same problem over and over and over again. I love this outfit, but I can't wear it.
Mm-hmm.
That's awesome. Mm-hmm. How long did it take after surgery to get to that point? To pictures with kids or shopping for outfits? Like so after
pretty immediate.
Oh, really?
Yeah. I mean, it's instant gratification.
When you can
surgeries.
Be in public again and not, be hunched over and whatever, it's pretty immediate. We didn't have too big of a problem with swelling, a little bit, but nothing outrageous. And so I think I had my surgery in February, and by May we were at the beach. So
by May, you were already at the beach?
Yeah.
Yes.
When was your surgery?
End of January.
End of January.
End of January.
And by May, we were at the beach.
Yeah.
Excellent.
In 2-piece swimsuits. Mm-hmm.
Oh, great.
Mm-hmm. I'd say, probably 12 weeks but that's the recovery period. So anything before, before that, you're wearing a faja and you're wearing things. But after that point, yeah.
Well, we had already, we had been eyeballing an outfit from Skims. And we couldn't wear them because of the blob and all that. I mean, we could, but
it's just not right.
Yeah, it just wasn't right. And so Emily had bought me and surprised me with Skims like the day of my surgery. So pretty quickly, like
thoughtful for that stuff.
She is.
It's tough exterior.
She does.
Sweet to soft.
And she's so good at gift giving too.
Really?
Yeah.
I just like to spend money.
I never think of her. She's always like, yeah, she shows up to my house with cinnamon rolls and Skims. And so then it was just like, I've got to get out of these garments so I could put these Skims on. So as soon as
it's like motivating.
As soon as I could, I was putting the outfits on and I was wearing them around, and it's instant. Like the first time I saw myself, it was like, and that's what I think more people should know is that it is immediate. Yes. The first time you see yourself, it is such a radical change that you are like, this is the best decision I've ever made.
I don't know if it's advisable or not, but I have a picture of Teighlor on my phone from the night of surgery, and we took the garment off just to see, and it was unbelievable. It was really crazy. Present. Yes. But I have a picture of her hunched over looking crazy. But her stomach is so flat.
So flat. To the point where her husband actually
I showed my husband. Yeah.
Well, he came over.
Oh, that's right.
And at this point it had been several days, and so he was like, can I just see like how,
because I had not had I was 3 weeks from surgery.
What your belly button looks like, because she was right after me. So he was like, I just want to see what it's going to kind of look like. And as soon as I like opened it up, he was like, his eyes were so big that he noticed a radical change. And it was
it was crazy.
It was crazy.
So it was pretty instant.
Can y'all talk a little bit about, this has been a theme in the practice for the last couple of weeks, just the emotional journey after a mommy makeover. So y'all, right now we're talking about the celebration of the flatness. Not everybody has the amazing positive outlook on life that both of you guys really have. So it really helps the surgery. From my perspective, when I see a patient like yourself coming in going, this is all going to be amazing. It's all about, some people are more warriors or they're more, sometimes postpartum depression can be an issue, so we have to time all of this right so that whatever is best for the patient. What is the emotional feel, besides the flatness of it? The acceptance of your new self, the self-confidence boost. I don't know. What is that like afterwards? We're talking, I'm talking month 5 and 6. Once that's it, you're back to work and you're back to reality and you're back to wellness and working out and, looking at the weight on the scale and just all the normalcy of it all. How would you summarize the emotional journey after a makeover?
I feel like it was all excitement for me, but I did have moments where I was just like, whose body is this? Like I feel almost detached from the new body, because you spent so long looking this way and feeling this way about your body that all of a sudden, and then you're like, I don't know. It's so weird, because then you're like, is this really me? Is this who I am for real now? Like, this is actually what I look like, wearing things you would never wear, being at the beach in a 2-piece, like wanting pictures taken of yourself. Who am I?
Crazy.
Yes. But I didn't have any struggles as far as any of that. The only thing that I will say is like the recovery, although immediately after, is not, it's crazy, but it's not like, it wasn't something I ever was like, I regret doing this. Never once did that ever cross my mind.
Yeah, nobody's ever told me this hurts. Give me my water blob back.
Yes, no. I never regretted it. But I like you do need time afterwards. It's a big surgery. Yeah. So I was getting frustrated with like, I just wanted to be better already. And I just wanted to
you were
feel
back to work right. Yeah.
Yeah, I just wanted to like jump right back in. And it was like one of those things where you had to slow down. She's worse about it than I am. So I was like, you've got to chill out. But other than that, I didn't really, it was just the detachment for me.
I think for me, and I think a lot of women could probably relate, my relationship with my weight for my entire life has been very up. I'm either gaining or losing. We always say this, we're either gaining or losing. And so I think for me, I remember having very early memories of like wanting to get rid of that little thing, even when I was, before children. And so I spent a lot of my, young years kind of not loving how I looked and not loving my body and wanting to change things about it, that by the time I actually did, it was just like euphoria. And I feel like that still carries on we're a year post-op, and I don't think that's really dampened at all. I think the fact that we can wear what we want and that we, when we're actually working out and things, that we're seeing the results because we've got muscle repair. Those things are just as gratifying as in the beginning. I really don't feel like I struggled too much with any negative emotion. I think that all kind of led up to it. And then by the time it was fixed, I didn't have,
Ready to let it
yeah.
euphoria. That's
Yeah,
good.
yeah.
That's
Well,
a good.
I think one of the things that also changed for me was that I would spend so much time staring at the scale. If I would see it increase even slightly, I would start to panic. Like,
Yeah.
I'm gaining. Since the surgery, I've let go of a lot of the scale issues.
Mhm.
Like
Excellent.
I do just look at the scale. I do say, okay, I'm in.
It's time to check
I
it.
need to
Yeah.
reel myself in for
Yeah.
sure. But I'm not nearly as
No.
concerned about gaining 5 pounds or
Yeah.
4 pounds. You know what I'm
It's
saying?
much
Like,
more of an aesthetic. Okay,
Yes.
how am I feeling? Where
I still look
yeah.
good in my clothes,
Yeah.
even if I did gain 5 pounds.
Okay.
I still
Mhm.
can wear whatever I want.
Because the
I'll
shape is
still be
different.
in a 2-piece. Yeah.
a lot of that shame and that obsession is
yes,
gone
it's
for
gone
sure.
because the shape is different.
Would you say that today, since you've invested so much in your body, that you take care of it differently?
Yes.
I'm assuming yes.
Yes, 100%.
No, you've invested at this point.
Yeah.
So you got, I don't want to just say
Yeah.
gain a ton of weight or anything.
Of course.
Definitely still want to maintain everything I have and in longevity. I want to just take care of myself and keep it well.
That's definitely a factor.
I would
It's a
assume
factor.
since you've put so much, it almost
Right.
helps you
Yes,
discipline.
it does.
It does.
Yeah.
It does. And that's
It
even
holds you accountable.
leading up
Right.
to the surgery. We buckled down because it was so motivating to know that you had this big thing
This
coming
light
up
at the end of the
that you
tunnel.
needed to, like really invest in yourself and make sure.
Advice that you would give yourself, your pre-op self. Is there anything that you would tell yourself prior? Hey, this is coming. So just be aware maybe that we might have skipped or that we didn't underline or highlight enough for you guys. I'm thinking stuff like maybe, it sounds like y'all did a pretty good job to focus on wellness. And, I would tell my loved ones prior to surgery, hey, be sure, and I do this a lot with the patients, like constipation can be a severe issue for some patients.
Oh, that was a thing.
Yeah.
Yeah.
I'm going to tell you about later appearance.
That was a thing.
Well, I'm just saying that to the previous version, the pre-op version of all, body contouring patients, I would say, hey, anesthesia can really slow the gut down. So really target that prior to the tummy tuck so that you can allow yourself some space post-op. What would you?
I would say that.
You guys are good about warning people, but I don't think anyone understands
Yeah.
the severity.
That's how extreme it can get. But other than that, for sure, I would honestly just want to tell myself that you got to be patient with
Uh-huh.
yourself
Mhm.
because you think that you can just. I was comparing it a lot to the C-section. Oh, I've had 2 C-sections.
It's very
I
different.
can manage
Good
this.
point.
It is a very different, and
Because
you've
the
got
C-section
to.
is decompressive.
Mhm.
Yes.
So it's
And
kind of in this instant because
Yeah.
baby. In this case, it's instant, but now you have
Well,
to right.
when my C-sections, I was up vacuuming by days 7 to 10. I was up like
Oh, interesting.
managing things, and I was up.
That's
and I was
actually very
moving.
relevant for your pain tolerance. What was your C-section recovery like?
Same.
Same.
She
Mhm.
was trying to jump around. She's trying to go
Walk upstairs as soon
patients
as I got
often ask
home.
me, is it like my C-section? And I don't really know what to tell them.
No.
I think it helps because pain tolerance is similar. How you'll respond to pain
Yes.
pills, that's similar.
Yes.
So
Yes.
I now have kind of said I think it's similar, but what would you guys tell me to
I think it
tell my patient?
depends.
I think it'll be a good indication
Uh-huh.
of how you're going to manage it because if you had the C-section and then you were like, okay,
Bedridden for a month. Okay,
exactly.
That's not a good
Now
sign. Yeah.
you should really plan for you to really be in a long recovery time. If you managed it, because with a C-section, you still get that kind of burning sensation if you stretch it too much or anything like that. So if you already have that in your head, I think that you could manage it, but you do need to prepare and slow down a lot more than.
I do think that it's the muscle repair that sets it apart. So as far as like the incision and that care and kind of those feelings, I honestly thought that the tummy tuck scar and that process was probably less difficult than the C-section scar was because there was a lot of burning that I had with my C-section scar. But I would say the muscle repair is much deeper and therefore it's a longer recovery, not significantly, but it
Makes
is.
sense.
Yeah.
As we kind of wrap up, I would like to hear if you guys have some anecdotes about feedback that you've gotten from friends or loved ones that really brought this full circle. Oh my gosh, I'm so glad that I did this. Or I just really love myself now, which is the whole intention of the surgeries. I don't know, what responses do you guys have for this sort of
So I have two. Right after the surgery, I had my very good friend since I was 10 come over and stay with me for a couple days while my husband went to work. She has no children.
That's a great idea.
But she had lost a significant amount of weight, probably 80 to 100 pounds. And she's been doing CrossFit for about 8 years now, but her excess skin on her stomach is still there, And so we were talking, even for her, she was like, this is incredible, your transformation. I think I'm going to do this. What do you think? I've been working out, doing CrossFit for almost 10 years now. It's still there. Do you ever think it's going to go away, type of thing? And I was just like, you can't exercise your skin at this point. That's not going to go anywhere. I don't think you'll need anything super excessive, but it would be worth it for you, in my opinion. Like, I think at this point you have abs under there that you just can't see.
Right.
So that she validated everything for me. Like, it's made such a radical change. But I will say Emily's husband at one point afterwards was just like, I don't think you guys even realize that you can walk into a room and like catch everybody's attention. You guys have so much confidence on your face now that even if you're not necessarily showing off your body, you could see it all in your face. That you guys could just walk into a room and shut it down if you wanted to, kind of thing. And I'm like,
yeah. We were
just in my driveway.
Yeah. Yeah, that's right. That's right.
Just in my driveway. And he was just like, I don't know, but you guys
radiating
are, yes. Yeah. And he's like, you guys are like, when you walk into a room, you catch everybody's attention, and not just because you look good, but because you can tell you carry it with you.
Feel you're carrying it. Awesome.
Yeah.
Yeah.
Thanks.
What a little nugget of wisdom from him. I would say that mine is more geared toward, not realizing the results that you're getting by even just 1 or 2 surgeries. So one of the things that is a running joke is that I got a BBL, even though I did not. I got flank lipo. But one of the things that I thought was really interesting, for the record, no BBL. Not that there's any shame in it. I mean, I've got my fake boobs and my tummy tuck, but regardless, it was interesting to me because the shape of my body changed so drastically that people were assuming that I got even more work than I did done. So it was kind of a, encouraging, thing to hear where, even if I didn't go to that, next step, my body changed in ways that I didn't even anticipate.
Worth it. Always worth it.
Well, thank you guys so much for being here. And thank you guys for tuning in. What a great Dallas Plastic Surgery podcast. I really enjoyed my time with you guys. I've really enjoyed the whole journey with both of you guys. It's been super fun. I'm sure the patients out there, even the prospective potential patients out there, are very grateful for y'all sharing your personal experience through this.
Yeah, we appreciate you, Dr. Meade.
Yeah, thank you. Yes, we do. We do.
Pass out cards. We got half the office in here.
Thanks.
Headed your exit. So thank you guys.
If you're thinking about doing it, just do it.
Yeah.